Have you been waiting months, maybe even years, to finally get in to see an endometriosis specialist? Do you want to get the most out of your appointment, but you're unsure what to ask or how to prepare? If you're answering yes to these questions, you're in the right place. Before we jump into talking about how to prepare for your endometriosis specialist appointment, please give this video a like, share it with a friend, and hit that subscribe button. In this video, I'm going to walk you through how to prepare for your endo specialist appointment, what information to bring, how to talk about your symptoms, what to expect, what questions to ask, and how to advocate for your needs in the moment. Let's dive in. Let's start with your story. It's important to describe your symptoms and lived experience with endometriosis or suspected endometriosis in detail. Instead of saying something like, I have painful periods, use descriptive words. Provide details on the number of missed days of work or school. Describe the level of disturbance to your quality of life. Detail the amount and frequency of over-the-counter pain relief used, and provide specifics on where and how often pain is felt. Some important questions to come prepared with answers to include when the pain starts. Is it before your period, around ovulation? Is it every day? Where the pain is? Is it in your pelvis, your back, your legs, in your rectum? Does the pain travel? Does it change throughout the cycle? Do you notice unique triggers like exercise, stress, or certain foods? How does the pain feel? Is it sharp, burning, or achy? Is the pain sharp in your pelvis but achy in your legs? Describe how it affects your life. Are you missing work? Can you not exercise? Are you experiencing a lot of bowel or bladder issues and or symptoms? Are you experiencing any fears over not making it to the toilet on time? And how often are these disturbances happening? What makes it better or worse? Movement, food, stress, medications, intercourse? I also recommend bringing 3 or more months worth of data with you, mapped out in a calendar format. Print out a simple image of a figure back and front and circle parts of the figure where you experience pain. Something similar to the image on the screen. I also recommend that you print out a list of descriptive words that describe pain. Many free downloadable worksheets exist online, like the one pictured on the screen. Print that off or bring a digital copy with you to provide the specialist with. Don't forget to mention non-period symptoms or symptoms that don't seem like they're related to your periods or your endometriosis. Symptoms like painful sex, bloating, fatigue, digestive issues, urinary symptoms, bladder pressure or pain, mood swings, abnormal bleeding patterns, allergy type symptoms, left or right-sided pain, rectal pain, difficulty breathing, pressure in the chest, and similar symptoms to the one described here. While these may not seem relevant, endo is a whole body disease. Mentioning these patterns and symptoms may help your specialist formulate a better treatment plan for you, organize appropriate referrals and tests to inform medication recommendations that they're going to make for you. Now let's switch gears and talk about what you can expect. Many doctors follow a set medical algorithm or clinical practice guidelines. You can definitely expect a conversation about hormonal birth control or hormone suppressants, things like birth control pills, IUDs, Vyzan, or Oralisa or Lupron. You might also prepare yourself for a conversation about surgical options like laparoscopy or whether they want to send you for imaging, and or a referral plan, like a referral to gynecology, imaging, or a pain clinic. Since recommending hormone therapy is part of the practice guidelines for endometriosis patients, come prepared knowing what you are and are not willing to try. Be aware that hormone therapies don't all work the same, and some pills contain different forms of synthetic hormones than others. Some helpful questions to ask if you're open and willing to try hormone therapies include questions like, what are the side effects? Could we test my hormones to determine which combo pill is better suited to me? Does the actual pill contain any concerning added ingredients like sucralose, lactose, cornstarch, sucrose, or iron? When the time comes and I want to transition off the pill, what support can you offer me at that time? How will this hormone therapy affect my liver or thyroid function? If I have a poor reaction to this hormonal medication, what is the alternative? Be sure to also highlight some symptoms you already experience, like low energy, mood shifts, bladder urgency, and ask if these hormone medications can make these symptoms better or worse. Other questions to ask include, will this hormone therapy affect your future fertility? What effect does this medication have on your bone health? Do you need to take any supplemental nutrition while taking this hormone therapy? What are the risks in delaying hormonal intervention? Is there a non-hormone option you can try first? Why is hormonal intervention a better choice now versus surgical intervention? What labs or monitoring will be done while you stay on the hormone therapy? What are some signs and symptoms to look out for that might inform whether you stop taking the medication that's prescribed? You might also ask how your specialist patients do with this particular medication that is recommended to you. You might also inquire if there's anything unique about your case that concerns the specialist with regards to starting that particular medication. A few important things to keep in mind no matter what your specialist says. No hormone therapy stops progression of endometriosis. The literature is mixed, but no study confirms hormonal interventions stop endo progression in every single user. In fact, endo is often progressing beneath the surface, and hormone therapies mask the worsening of symptoms that correspond with this progression. Many combo pills include sneaky ingredients that may trigger GI symptoms, constipation, nausea, or other unpleasant symptoms. If you have any starch, sugar, alcohol, or lactose sensitivities, be sure to mention this to the doctor so you are not prescribed a pill that contains these sneaky ingredients. Many endo patients develop unpleasant symptoms after starting the pill, not knowing that they have sensitivities to the sneaky ingredients found within the pill. When it comes to surgery, an important question to ask yourself is the goal of this surgery pain management or fertility preservation? This information should then be communicated to your surgeon, as a fertility preservation approach may be a little bit more conservative when operating on or around the ovaries and or the fallopian tubes. The surgeon may also check for things like endometritis within the uterine lining in women with a fertility objective during the surgery. If you suspect or have deep infiltrating endometriosis on the ureters, bowel, or bladder, or if you have large endometriomas on the ovaries, surgery is likely needed to preserve your organ function or to avoid things like ovarian torsion. Be sure to highlight symptoms consistent with endo on these organs so that your surgeon knows to take a proactive approach. Some questions you might ask prior to endometriosis surgery include, but are not limited to, questions pertaining to the skill level of the surgeon. For example, how long have you been performing these surgeries? How frequently do you perform these surgeries? What techniques and instruments do you use? How many incision sites will be needed? Do you foresee the need to create more incisions? Do you excise both deep infiltrating and superficial endometriosis? What are your expected surgical outcomes? And what information can I provide to make this easier for you to answer? Often more than one kind of surgeon is required within the surgery, especially if you have endometriosis on your bowels or bladder, or if you have endometriosis in the thoracic cavity. You might inquire who exactly will be performing the surgery. You may also ask questions about staging and how records will be taken. For example, you may ask if the surgeon is able to tell you what type of endo lesions were found. There are several types, some redder in color and more active, while some are white in color, which tend to be older and can bind organs together. You might also inquire if the surgery will be recorded or if photos will be taken. This is something you might consider having in your records in case you need to see another surgeon or specialist in future. You certainly want to try and avoid this, but sometimes surgeons leave lesions untouched due to fear of puncturing delicate structures or organs. If this is the case for you, request the surgeon make a note in your file or take a photo so that you have a record of where the lesions are located. Some other questions you may ask include, will my organs be preserved? Under what circumstances would an organ be removed? How will you limit the risk of scar tissue formation? Will all areas of disease that are removed be sent to pathology for confirmation of endometriosis? What stage of endometriosis would you classify me as? Can you provide a detailed summary of where my lesions were found? You may also be curious about your recovery time, so inquire about the surgeon's expectations around your unique recovery timeline. You may also ask how long you need to be off work or school and arrange any necessary doctor's notes or letters at that time. You might also ask what the surgeon's clinic post-op policy is. When should you follow up? You'd be surprised how many women go through excision surgery with no follow-up or post-op plan. I do have a full-length video on surgery prep and recovery, which I will link in the show notes below, so be sure to check that one out for more surgery prep and recovery tips. So last thing before we move on to talking about a referral plan, some endo specialists do something called endo mapping. Endo mapping refers to a diagnostic imaging procedures used to map the location, size, depth, and severity of endometriosis lesions. This helps the surgeon understand what's going on within your pelvis before you even have surgery. Endo mapping improves surgical planning, reduces the risk of incomplete excision surgery, helps determine if surgery is an appropriate next step for you. It helps validate your experience as a patient with endo. It's non or minimally invasive, and it may help better understand if there are any co-conditions like adenomyosis, fibroids, or cysts in addition to endometriosis. While endo mapping isn't flawless, it's an amazing step in the right direction, as for many years surgeons were going in blind, doing their best to excise endo completely, but with little to no expectation about what may be found and where. If endo mapping is an option through your specialist, it's an excellent thing to discuss during your appointment and get any necessary testing or procedures or scans done prior to the surgery. Okay, now let's talk about a referral plan. Endometriosis is a complex whole body disease. Many studies exist on the benefits of allied health services like pelvic floor physiotherapy, various cognitive behavioral therapies, and nutrition and diet for endometriosis. Prior to your appointment, I suggest looking up endometriosis or chronic pain specialized pelvic floor physiotherapists, social workers, psychologists, and dietitians in your area. Come prepared with a few names and request that your doctor send in a referral. Often a referral is needed for you to get coverage through your insurance provider. You may also seek out a pain clinic locally and request a referral there. Pain clinics specialize in unique therapies for pain management. Pain clinics also use unique tools like low-dose naltrexone and/or medical cannabis to support chronic pain patients. Acupuncture can also be helpful, so if that's something that appeals to you, it would be great to check that out as well. If your specialist is not an endosurgeon, you might also consider seeking out a few endometriosis specialized surgeons in your area that are taking on patients and request a referral there also. Now let's move on to talking about some labs. One of the best ways to feel confident about your next move on your endosymptom improvement journey is to run some labs. While labs should be run based on need and symptoms, some important labs to consider requesting or running privately through services like Request a Test or Blood Labs Canada include firstly iron studies and ferritin. These are common deficiencies in women who bleed heavy or who are just living with endometriosis, and low iron will reduce your body's capacity to fight inflammation. Another one is vitamin D, which is associated with large endometriomas. Inflammatory markers like C-reactive protein and ESR. A hormone panel including FSH, LH, estradiol, progesterone, DHEA, and testosterone. A thyroid panel including TSH, free T3, free T4, and your thyroid antibodies. Blood sugar markers, especially including fasting glucose, fasted insulin, and your HbA1c. And nutrient markers like B12, magnesium, zinc, and folate. How might these labs help guide you on your next steps? Well, in many ways, but I'll give you just a few examples. If your iron is chronically low and you bleed heavily, interventions like tranexamic acid or an IUD may be a better option over other forms of hormone therapy. If you're already bleeding abnormally, a progestin only might not be the best option for you, as a very common side effect is spotting or abnormal bleeding. Consulting with a dietitian on the best form of supplemental iron and how to maximize absorption of iron in the diet will go a long way to help you feel better. If you have a very, very high inflammation markers, you know that your inflammation reduction strategy will need to be aggressive. In this scenario, you might do well to pursue surgery, but some people have so much inflammation surrounding the endometriosis lesions that an inflammation reduction plan is a necessary first step before the endometriosis can be excised. If your testosterone is high, you might want to be careful to opt for a combo birth control pill that has a form of progestin that's more structurally similar to progesterone than to testosterone, because if you take the latter, this might exacerbate symptoms of androgen excess. In this scenario, you will know to also tweak your diet to support testosterone reduction through strategies like spearmint tea or more zinc-rich foods in the diet. Let's talk about a couple of red flags not to ignore. It's really sad and unfortunate, but true that many women are dismissed or gaslit during these appointments. Here are a few red flags to watch out for. The first is if your symptoms are dismissed with comments like painful periods are normal. Another red flag would be a specialist who's quick to jump to birth control first without doing doing any other investigations, scans, or blood work. You may already be at a stage where surgery is needed, and putting you on birth control may only mask aggressive endo progression that can leave you worse off if you wait a few years to pursue surgery. Another red flag is an indication that the specialist doesn't recognize the flaws in imaging when it comes to endometriosis. If you hear something like, "It doesn't look bad on imaging, so you're probably fine," that's concerning. While deep infiltrating endometriosis might be shown on an MRI and might be visible to some trained experts who can see endo via ultrasound, these forms of imaging are imperfect when it comes to endometriosis. They can often miss superficial endo or endo in other parts of the body that are not visible as part of the scan. Any experienced, honest specialist would recognize these limitations and follow up a clear scan with a laparoscopy to confirm endometriosis. On another note, if the surgeon only performs ablation, that is also a red flag. Ablation surgery has a higher and faster recurrence rate than excision surgery. Ablation is a burning of the top layer of the endometriosis lesions, which can trap endo beneath that layer, often causing more pain and adhesion formation. Any mention of delaying treatment until you're ready to get pregnant is a red flag. Endometriosis is a progressive disease. Egg reserve can decline quickly in just a few short years, or even months in some cases without intervention. Tubes can become blocked, and inflammation from endometriosis can make the internal environment less ideal for sperm, egg, or an embryo, complicating fertility. There are many fertility preservation techniques you can discuss with your specialist. If none are presented to you, that might be a red flag. Preparing for your long-awaited appointment can take some time, but it can also completely change the outcome for you. You deserve to be heard, supported, have all your questions answered, and to be taken seriously. If you found this video helpful, hit that like and subscribe button and drop a comment if you have more to share with our community here. Thanks so much for tuning in to today's video, and we'll see you in the next one.